Being an international medical graduate, English is not our main language, and that's where we struggle a lot as well, and we feel like less confident. I knew the structure, but it was more theoretical. I didn't know how to put it into a practical way. It's not about the knowledge, it's about how you implement them and how you explain to the other person who is sitting right in front of you. If you don't know about anything, how to proceed with that.
How would you like to pass SCA on your first sitting? Today I'm interviewing a GP trainee who had some setbacks with AKT. She was unsuccessful 2 attempts and she didn't want to have the same experience with SCA. So she decided that she would give herself the best preparation and eventually pass SCA on her first sitting. Hi, Dr. Pooja. Congratulations on passing your exam. How are you doing?
Thank you, Dr. Kwun. Thank you so much. I'm doing really great and really happy to get through this on my first attempt. And obviously, it wouldn't have been possible without your support.
Thank you very much for agreeing to share your story today, because there's many trainees who would help and not many people like to share their story, but I know how inspiring it is for somebody who listened to, especially you, because I remember when we had a chat, you had some issues with communication and feeling a bit shy as well. Tell us a little bit about yourself for somebody who's listening right now.
I'm currently in ST3 in East of England, Deanery. Gave my exams I think in June attempt, which I cleared through. It was my first attempt. So me always being a kind of like a anxious personality and also a kind of like an introvert, a slight introvert, I would say. The communication part has always been a challenge for me. And again, SCA exam being an exam where the communication plays a big role. So I felt like this always added an extra stress to me whenever I thought about it as well. And again, AKT still being on my list, this created more anxiety for me. So, but then I'm really happy that at least one of the things has been off my list now.
So how did you decide to take a pose with AKT and then go with the SCA? What was the decision like?
It was really confusing, to be honest. Gave my exam, AKT exam. I was really not prepared for it. My first attempt, I would say, but then second attempt, I was really serious, and then I focused a lot as well. But unfortunately, couldn't get through it. But then I felt like this is a time I should focus more on the SC, and again, because my SCCT date was approaching as well. When I thought about giving this extra, the focus towards the SCA. So I thought like I'll just give some pause to AKT and focus more about SCA, because SCA was I thought it was more challenging for me because of the communication skills and all as well. So that's the reason I just reserved the exam and decided to go for it.
Tell us a little bit about your preparation. What did you do when you started to prepare?
So initially, as soon as I reserved my exam, I definitely knew that I need something more focused and enhanced. As I said, like I'm not a great communicator. We've been doing some recording sessions at work. There's the feedback from the trainers as well, which was once a week, and then I was really not doing great on those things. I was using jargons, and then my consultations structures was not really framed as well. So I was looking for the enhanced courses, and there were many as well, but then I wanted something where I could get like one-to-one coaching sessions rather than going into a big mass and getting those readings or courses. So that's when I got to know about you as well, and then immediately I went through it during the initial phase of my preparations.
How was it like in the first week once you joined the program? How did you feel?
I remember we did some role plays on the first day as a trial, and then I really liked the way where when we were doing the consultation, you paused it and then you explained about where I was struggling. You gave me feedback right then, and then you made me do the role play again. So I knew like what were the changes I had to make, which was really good. I felt like I was more confident in like knowing my flaws, and I knew where to do the improvement as well. Uh, so yeah, I felt you get the feedbacks every time, but then this was like more personalized to me. And because everyone is different, you get like generalized feedback is as in like you have to improve this, you have to do that, but then this was more personalized to me, and I knew where to work harder.
So tell us about how did you structure your consultation, because this is a big pillar of how you do well in the exam?
The first thing and the foremost thing for me was using a simple language during my consultation, because you would remember I always use like very complicated medical jargons, which was very difficult to understand. Again, being an international medical graduate, English is not our main language, and that's where we struggle a lot as well, and we feel like less confident. The second thing was a structure. I knew the structure, but it was more theoretical. I didn't know how to kind of like put it into like a practical way. So I struggled with those things, where the time management became a challenge because I was not actually following it. So you when on our first session, you mentioned about getting the ice earlier so that we have like more time to kind of like structure our consultation, where to take it, because the ice is main thing in the SC preparation. So that actually I would say made a long big difference as well, like simple language, having ice earlier. So yeah, that is the like main changes that I actually implemented.
So that's really good that we unpack the ice now, because sometimes it can be confusing when somebody is saying the idea, then you might think it's the concern. So tell us a little bit about your learnings about how you elicited ice.
I used to ask ICE very later during the consultation. So, start the consultation with open questions, and then I actually carried away with the consultation. I would say I lacked control over my consultation, in simpler words. So once I started putting ice earlier, around like second or third statements, then I realized, you know, how to address patient concerns, because consultation is mostly about like addressing the patient concerns rather than how we want to take the consultation forward. So it was like more focused, more centered, and the patient, and it was like more clarity to the patients as well. So that's when my confidence grew, and I finally started feeling in control of the consultation instead being controlled by it.
So you knew how to lead the consultation and asking question within the right time frame. So other problems that trainees commonly face is asking too many questions because they don't want to miss something.
I would say we need to be having a, like to follow a simple process rather than making it more complicated, and that's natural to do that as well. Like me being on the same shoes, I had been kind of like complicating SCA and the consultations as well. I think using the simple language, having a structures as we talk about, main and foremost thing I would say is the eyes, to be honest, so that once we get those, we avoid going into like a complicated way and then adding like getting more extra information, which is normally not required as well. So yeah, stick to simple, clear language. I don't think we don't need fancy phrases. Just sound like a real, safe, kind doctor. Empathy, sympathy, and then I think most of us, everyone would value clarity over complexity.
Are you struggling to identify your blind spot? Maybe you're not getting enough feedback. If you're looking for help, I've opened up a few spaces on the coaching program. Click the link down in the description to book a call with me, whether I can help you. And if I can help you, we can work together to help you pass your exam. I'll see you right then. There's so many things that is being taught about SCA and people overcomplicate it. And if you simplify it, it is simple because then the patient understand you. You're not overloading them with too much information, and you're not leaving them with more questions when they finish the consultation. So share with us about your preparation in terms of the day to day. What were you doing in your practice or role plays? What exactly helped you to score first time?
I think the most important part is to start early and to be intentional as well. So you need to have that focus, definitely, and the clarity as in like what you would like to do to pass the exam on the first attempt. I would say there's no point in doing endless role plays if you are not doing it in the right way. So I was focusing more about quality over quantity. And again, as I said, the feedback sessions really helped me to focus like where I have to do the improvement. I reflected after each case. Even when we had the sessions, I just sat down and then kind of like reflected where I have to make changes. I made a point, made sure I implemented those towards like when I was doing my recording as well. Even while I was getting a positive feedback from my trainers in terms of like whenever we had the session and I implemented the changes. Um, I sometimes asked myself what went well and what could have been smoother. Again, sticking to the simple, clear language, we talked about it. Again, frameworks were helpful, but then the real goal is to have a natural human conversation within a structured timeline. So I talked about, I kind of like practice summaries and prioritizing the patient concerns, even through the management as well. I practice summarizing the management plans. And the main and foremost thing was the feedback. I to get the real feedback, worked with someone who can point out patterns in my consultations and can give an honest and constructive guidance, which made a huge difference for me.
Let's talk about the clinical management then. What were the things that you didn't know, and then when you learned about it, then maybe you realize, okay, that's how it works.
I would say we all know about theoretical things in terms of management, and we all have been working so long in NHS or in our medical profession. It's not about the knowledge, it's about how you implement them and how you explain to the other person who is sitting right in front of you, who is a layman who doesn't know about medical terms and who doesn't know what to do, and they are seeking guidance from yourself. So if like me, even me, I felt a pressure to explain everything that I knew about any kind of like medical presentation, but I felt like it's not that way. It's not just about like how to address the patient concern. Like for example, if a patient is presenting with any of the like for example any medical problem, but then their ideas or their concerns can be as like different to that, even related to that problem, right? So it's not about bombarding them with the medical management and he doesn't understand a thing and is clueless what to do. So it's more important to kind of like implement our knowledge and then structuring them according to the patient concerns, and then to check that they are happy and then they have understood what to do and then they know what to do further. So that's what is the summary, I would say.
So you were individualizing your management and explanation so that it was tailored to that person rather than just overloading them with your information. Because I think that that's a big issue where sometimes people feel they need to impress examiner, so they're sharing so much knowledge.
Even I would say even examiners would like simple, kind consultation. I mean, safer, I would say, in short. So it's not about letting them know how much you know. It's just more about like how you have made sure that you have made that patient safe and then more happy and content about the consultation. Again, as I said, we can be overthinking, especially again being not having English language our first language, and then we might feel more under the stress as well, and we start to use complex language. And I've seen a lot, even with like with my colleagues whom I practice with, we used to do the same kind of mistakes as well. That made us go off the track as well, which made the consultation more stressful, disjoint. So it's just about knowing what to do, but being able to do it consistently and naturally under the pressure, because obviously exams would be pressurized, but then it's more about managing that pressure.
Yeah, let's talk about this then. Like when somebody is taking an exam and there's stakes that are quite high, it is really nerve wracking sometimes. So, how did you manage that anxiety?
That's a really really stressful thing. I mean, it's very, I mean, it's tricky to be honest. And as I said, like I've always been an anxious personality when it comes to communications and all. Um, my exam was in the afternoon session, so it was more stressful, I would say. So like speaking to your trainer, supervisor, if you have any questions, you can just ask them. Uh, it's more about like having confidence over yourself, because again, as I said, like it's not about knowledge. We know about a lot of things about not a lot of management. It's about how you present that day. So it's more important for us to make ourselves calmer, because if you are under pressure, you wouldn't perform nicely, you wouldn't be able to give your 100%. So it's very important to manage that stress. Take a deep breath, I mean, if you are into meditation, I am into meditation, just meditate and see how you go with it. Speak to your supervisor, colleagues, and then they will be able to help you a lot as well because of their experiences. Breathe, that's the main thing. Because as I said, if you're anxious, you, even if you know anything, you wouldn't be able to express that, and that would like wouldn't be a positive thing for us.
It's important that you don't let yourself get worked up, and you need to know how to relax. And one of the things that we teach in the program is to train trainees to a very high standard, so that on the day of the exam then you fall to that standard. Whereas if you've not been preparing to a very high level, obviously you will feel anxious because you feel you haven't given it your best. But I think in your situation, you did what you could and you did the best prep. So then going into it, you felt like you could achieve a pass. So tell us a little bit about when it comes to anxiety in terms of not knowing what this case is about, uncertainty. Were there any issues where you felt, I don't know, how do I manage this? And how did you respond to these types of scenarios?
Absolutely, there were many cases where you would feel that way, and I even thought that I had failed that, but then it was a surprise to know that I had actually passed those stations as well. Yeah, the uncertainty is the thing I always struggled as well, and we I used to talk a lot about this with my supervisors as well, like how, if you don't know about anything, how to proceed with that. But I think it's more important is because we have a structure and that helps a lot. So if you get the ICE thing, if you know the social history and whatever question you need to ask, so that covers things like you just need to know about your patients. Just don't treat them as a patient. Just treat them as a friend who you are having a talk, like, having a talk about. And then if you know about, like, for example, if you're trying to address the concerns, what questions you need to ask them, what are the right word that you need to tell to give them sympathy, and then to let them know that they are being listened to. So all those are things. But then in terms of management, if you're not sure about it, just make sure that they are safe, and then there you are doing the right thing. You don't always, like, you wouldn't know everything, and in GP practice is a lot about, like, a lot of variations and a lot of about uncertainty as well. But if I think if you ask the right questions in data gathering, and then if you make them feel listened to, if you make them feel like if you point them towards the right directions, and I think that would help you to ace the consultation as well.
Yeah, so you don't need to have all the answers as long as you can still manage it and help the patient to find clarity. That way, then the patient will feel like there's something being done about it, or you're coming up with some sort of solution without having to know all the answer because you're being tested on the uncertainty. So, tell us a little bit about what was it like when you realize you got the results and you look at it.
It was very hard for me to believe in the first place. Like, you wouldn't believe, like, I checked my results for like 5 or 6 times just to make myself like really believe about it. The first time I saw my result, I just like jumped, and then I was really happy. It was very overwhelming as well because you know how hard you have worked, and then you've been thinking about all the time about exams, and then the consultations, and then you feeling yourself that you're not a very best communicator, but then seeing that you have actually aced through it, it's very, very, very surreal moment, to be honest.
What did you actually think about the process now we're looking back with your prep?
I would say it is more about confidence, as we talked about earlier as well. Don't compare yourself to others because everyone has different challenges. Everyone is different, actually. We just need to put a lot of uh, hard work, consistent, focused effort, and the trust is the main thing. You need to trust that it's working, actually. So because the preparation journey is quite long, and you will come along a lot of people who will give you like varieties of suggestions, but if that's not working for you, and it might not work for you, because as I said, like, everyone is different. So I think it's more about you reflecting on where you lack and consistently working on those fields, rather than, like, you have a role play with different persons, but then if you try to pick up different things and like different timings and don't are not consistent about it, and it wouldn't work. You will be a mess. You will be having a like more kind of like confusion situation. So it's more about consistency, reflecting yourself, know where you are lacking and then work for it, get feedbacks on those areas, I would say.
Yeah, I think that's a really good point because I have seen sometimes trainees, they're getting a lot of feedback and conflicting advice as well. So then they're lost, they don't know what to do. One person's telling them that, the other person is telling them the opposite. So when you actually have clarity in your mind, everything falls into place. And it looks like you went from being a little bit unsure, not knowing what to do, and then you just followed a process and you came at the end of it. Now you're more confident. So, if somebody right now is considering maybe they need to get one to one support, but they're not too sure, maybe they have some objection, what would you say to that person?
Well, I got you as a guiding person when I decided to give my exams. Like I came through your course and then I did my own research regarding. I visited your website and kind of like found out that if the course you're providing would be the right course for me or not. And then when we had a first call, we did. And you asked me if like how dedicated I am towards it, and then I said like 100%. So that was a turning point for me. So I would say if you need a one-to-one sessions, like explore and then see what would work for you. For me, your courseware worked really well, so if anyone is thinking about your course as well, you can have that first session, the trial call, we get it, and then you know about your focus, like your dedications and what you need to work harder on that as well. So as I said, again, everyone is not same, so you need to know what you need. I wanted one-to-one focus and coaching, so I found you, and then that worked really well for me. So just need to know what where you lack and then work for it actually.
Yeah. So the one to one is not for everybody. And it is for some people who know that they've got some learning needs and need that extra support, personalized support. And if you feel like right now, maybe you're not getting enough feedback or you're completely lost, I'll leave a link down in the description. I've opened up a few spaces on the coaching program and we can have a chat. It's completely free. See whether I can help you. And if I can help you pass your exam, then we can work together. So now going forward, you got your AKT coming up, and what's your plan now to prepare, and what are you looking forward to?
So I've already started my preparation for my EKT, and as I said, like having SCA off the list, which we always been thinking as a big hurdle. It's like less stressful for me, and so because of the feedbacks and because I've already appeared in the exams, I now know where I have to work harder as well. So I'm like looking forward to it, having some the study times and study groups. So yeah.
Going through this journey is quite difficult, but then you've got so much growth out of it, and I think you're set up for success in your next exam. And if you got any question about the AKT or anything, please let me know. I'll be more than happy to guide you. It's been a pleasure to speak with you, Dr. Pooja.
Thank you so much, Dr. Kwun. Thank you so much for all the support. Again, definitely wouldn't have been possible without you because I know where I had to focus. And yeah, so all the best to all the trainees who are actually looking forward to give the exams. And as again, please don't complicate it. It's just a simple exam. It's all about like you don't need to be perfect. You just need to be safe, structured, and genuinely engaged. And please breathe. You'll be all right. And all the best.
If you found this video useful, you might want to watch the next case study here. And if you want to be one of the next case study, feel free to have a chat with me, see whether we can work together and get you to unlock your career. Take care, everybody. Bye-bye.